The rate at which babies are being born dependent on opioids and other drugs is rising at an alarming rate in Wisconsin.
News 8's Eric Jacobson joins us now in the newsroom with a closer look.
Martha and Mike, neonatal abstinence syndrome, or NAS, is the medical term for babies born addicted to opioids or other illegal drugs. In Wisconsin, the number of babies born with NAS has more than tripled since 2006. Local hospitals are seeing that trend, but the treatment to treat that disease is changing.
Nicole Hennessy is a hospital pediatrician at Gunderson Health System. Over the last several years, she has noticed a trend among newborns.
The amount of kids that we're looking at to look for neonatal abstinence is definitely increased.
According to the Wisconsin Department of Health Services, 142 babies were born with NAS in 2006. In 2015, the number was 598.
By no means has La Crosse been immune to this epidemic.
But doctors say that number is changing in a good way.
2 years ago, we saw a little bit of stabilization, and I'm starting to see 30% less than, let's say, at the height of it 4 years ago.
Hennessy says it's because babies and mothers are being treated much differently than 5 years ago.
We also are meeting with the moms multiple times during their pregnancy, so the mothers come into having their baby in a much better place.
If a baby is born dependent on opioids at Gunderson, they are not placed in neonatal intensive care, and doctors try to avoid prescribing opioid medication as a method for withdrawal.
These moms all keep their babies in their room just like any other mom would. So they're seeing what we're seeing on signs of withdrawal. They're the ones that are there comforting these babies 24 hours a day.
Above all, doctors from both hospitals say it's crucial to create an honest and open relationship with the mother.
I haven't met a mother yet who was dependent on the opioids that didn't care or love her baby.
They know that all of us are vested in the best for their baby and making sure their baby is safe, as opposed to coming into it feeling like these guys all think I'm a horrible mom. They're all gonna just take care of my baby and ignore me. We're a team.
Now, according to doctors, if a mother who is dependent or addicted to opioids discovers she is pregnant, doctors will prescribe alternate medication to prevent withdrawal symptoms. That's because there's a much higher risk of miscarriage if a mother goes through withdrawal.
Thanks a lot, Eric. And doctors say they are still unsure of any long-term effects babies will have if they've been diagnosed with NAS.